So let's talk about rTMS. So what is rTMS? rTMS stands for repetitive transcranial magnetic stimulation. It is a procedure which involves stimulation of the brain. It's a neuromodulation technique. It is used in certain conditions to achieve some kind of a recovery in terms of the symptoms that are targeted. So what do we do in rTMS? In rTMS, we use magnetic pulses over a particular region of the brain, which is in turn converted into electrical pulses in the brain in order to target a particular region of the brain, which in turn causes some amount of a recovery in terms of the symptoms that we intend to get some recovery with. rTMS involves application of magnetic impulses over the brain region in order to get some amount of recovery in certain conditions. So what happens in rTMS is the magnetic impulses causes a electrical charge on that region of the brain, which in turn activates the inactivated pathways that happens in certain conditions, and by activating them, the symptoms are relieved. What it can also do is increase certain neurotransmitters in the brain, like the serotonin, which is the feel-good neurotransmitter, which generally goes down in most of the conditions and in turn help them in their recovery. So generally, each rTMS session may last anywhere between 35 to 40 minutes. The first session generally involves a lot of evaluation and locating the target areas. So that session may be a little longer, but the subsequent sessions are generally around 35 minutes to 40 minutes. rTMS is a very effective procedure, and it is known to show a good response in about 50 to 60% of the individuals. And in fact, about 30% of them show a good remission of all symptoms. Generally, rTMS is done by a rTMS physician who is a qualified professional, usually a psychiatrist, who is well trained to administer this procedure, along with a rTMS operator who is there to assist the rTMS physician. rTMS is used in a wide variety of conditions, namely depression. Along with depression, it's used in anxiety spectrum disorders, post-traumatic stress disorders, obsessive-compulsive disorder, addiction issues like nicotine addiction, in certain conditions like ADHD, autism spectrum disorders, eating disorders. It is also used as a supportive measure in bipolar disorder and schizophrenia, and also as an assistive measure in some neurological conditions. rTMS is a safe procedure. It is a non-invasive technique and it is not painful at all. It can cause a little bit of a discomfort in the initial phase of management, but within a few minutes, you are well settled and doing all right. And with subsequent sessions that happens, you're very comfortable showing good signs of recovery. Before we initiate a rTMS session, we generally do a screening session where we evaluate the patient for the symptom profile, the progress of the disorder, the probable responses to other treatments, and then also evaluate for certain conditions that are there before we start off the procedure. One of the conditions that we are a little bit concerned about is a pre-existing seizures. If there's a pre-existing seizures, we generally contraindicate this procedure, or in certain conditions where it's absolutely required, under precautionary measures, we do conduct the procedure. We also evaluate for presence of any implanted medical devices on the scalp region, in the brain, in the head, or in the neck region, anywhere close to where the procedure is done, because if there is a ferromagnetic material, it can tend to get magnetized. How do we know that rTMS is working for you? Before we start off with the procedure, we are doing an evaluation in order to assess the severity of the symptoms. those scales are repeated and the evaluation is done at regular intervals in order to evaluate for the progress. Based on the progress, the psychiatrist evaluates and decides the number of sessions in order to continue and when to terminate the sessions. So here at Cadabams Hospital, we have the rTMS machine, which is a MagVenture Pro machine, which is well approved for all the conditions. This machine involves the electronic unit and the coil. Most importantly, this coil is used to target the particular region of the brain that we require some improvement with, and alongside there is a stand which is to keep the coil in position. For any enquiries regarding this procedure, please reach out to our helpline or the website www.cadabams.org.